Hi, my name is Katherine Bliss, and I'm a director and senior fellow within the Global Health Policy Center at the Center for Strategic and International Studies in Washington, D.C. I became interested in understanding more about the role of women as senior leaders within the field of HIV clinical research back in 2011 when I wrote a policy report on the history of the international AIDS conferences, which are large international gatherings organized by the International AIDS Society, which really bring the research community, the policymaking community, and global advocates together to review HIV progress, funding, program development, and to really talk about what's needed in order to make progress in ending HIV as a public health threat in the next several years. So in 2011, the conference returned to the United States for the first time since the early 1990s. And as I undertook interviews and carried out archival research in order to understand the impact of the conferences and the significance of its return and meeting within Washington, D.C., I became intrigued by the fact that there seemed to be so many women who were in very high-level senior positions of leadership within not just the International AIDS Society itself, its governance, its governing council, and the different sections, but also within the larger field of HIV clinical research. And I wondered, is there something, is it unusual? Is what I'm seeing really true, that there seem to be so many women in high-level positions of leadership within the field? Is there something unique about these women, or was there something about kind of entering the field of HIV as it emerged as a global health threat in the 1980s that really facilitated their emergence as global leaders? And what are the attributes that are most important for women, in positions of leadership on global health issues, particularly during periods of political crisis or funding uncertainties that have really characterized the world of HIV over the past several decades? So as I began to think about the leadership project within the context of the WomenLift Health North American journey, one of the things that I'd initially thought about doing was developing a kind of like an hour-long podcast, really identifying 5 or 6 different women within the fields of HIV who had been there from the beginning, from the 1980s kind of until the present, and talking with them about the history, about their engagement in the field, and really some of the key themes that they had seen develop over time. And as I talked with experts, with advocates, with people who are much more expert than I in the world of podcast editing and production, I wound up deciding that it might be more interesting to focus not only on a set of shorter interviews, kind of 30 to 40 minutes in length with 3 or 4 different people, but really to concentrate on a specific set of issues. And because so much has really been happening in the field of HIV prevention, because this is an area that is so important to the lives of adolescent girls and young women, particularly in Eastern and Southern Africa, where the incidence of HIV infection, continues to be very challenging for that population. And because, there's really so much that has happened in recent years around pre-exposure prophylaxis, the availability of long-term injectable HIV prevention, and so many new things on the horizon, I really decided to focus on, some of the women who've really been at the forefront of the prevention revolution, if you will. And so I wanted to center the interviews around a set of common questions. And these included what motivated their interest in infectious diseases, how did they come to work on HIV, what was it like as women entering a new field of inquiry in the 1980s and 90s, what had motivated them to assume leadership roles in the research field, and how do they kind of keep their teams together, particularly in periods of crisis? And what advice do they give to young women who are looking to enter this field, particularly after what has been a very challenging year in the period of global health research? So I was fortunate to be able to schedule and carry out 2 interviews, with the third to be done in January. The first was with Linda Gale Becker, professor at the University of Cape Town, who led the Purpose One trials around lenacapavir, showing that that was 100% effective in preventing HIV in cohorts of adolescent girls and young women. The second interview was with Rafael Sauter, professor at Columbia University and the head of ICAP, who was involved in some of the trials around cabotegravir, which is also a long-acting injectable for pre-exposure prophylaxis. And in January, I'll be talking with Nellie Mugo of Kemry about the intersection of HIV and sexual and reproductive health. So just to say a little bit, the themes that came out of the conversations with Linda Gale and Wafa really resonated. Those are the ones on the left, and they resonated very much with the themes that were so much a part of our WomenLift Health journey around leadership competencies. You'll see these are highlighted: courage, relationship building, really being resilient, and understanding that the work that you're doing is really focused overall on improving the lives of people most at risk. And always keeping that front and center is so important, particularly when the political winds shift and there are challenges that come forward. I want to thank the other women in Cohort A and also those in Cohort B. This is a picture from our immersion back in May when we all met and began this journey together. It's really been a pleasure to continue thinking about and talking about these leadership competencies and sharing ideas, and really kind of growing together and understanding that women really can provide source of strength, support, and solidarity within global health and really professionally as we work through many different fields and from many different perspectives to apply so many of the competencies that we've discussed over the course of this year, and that really resonate among those people who are really kind of setting the stage for the next generation of global health to come. So look forward to your questions and look forward to talking later. Thank you.